My name is La Rosa. I'm here helping a friend. We're leaving the U of U. We've been here visiting for the burn center. The last few weeks, she's burned both of her legs, second degree burn. Basically, I'm putting this video out there that will help a lot of people that visiting this clinic. U of U is one of the best, considered one of the best burn center in the whole country. And our experience here has been really horrible, and I hope that this will reach a lot of people and educate a lot of people that comes here. Basically, the first two times we here, they were taking care of us, being nice. The first time that we were here, they were straight up tell us that my friend needed a skin graft. Some of you don't know what that is. Basically, skin graft is they take skin out of a part of your body, mostly legs, thigh, to put it in the area that was burned to help the skin, the wound recover quicker. The first few times we were here, they were already pushing for the surgery, the basically skin graft, to $30,000. And this is not, you got to do your research, but most insurance company does not cover this procedure, by the way. And they also don't tell you, what they don't tell you is that when you have this procedure done, you're gonna have to be admitted to the hospital for at least 1 to 2 weeks for the new skin, where the area, they call it the area where they cut the skin to put to the wound area. This area cannot be moved for about 1 to 2 weeks for the skin to grow back. So you would have to be admitted into the hospital. And most of this, as I did research for my friend who doesn't know much about insurance and billing, is not covered by your insurance. So if you sign the little paperwork that says basically giving your consent and understanding that if the procedure is not covered by your insurance, which most insurance will not cover this for some reason, that you're gonna pay out of pocket for these kind of procedure. And it, again, it's very costly. We are at the U of U. We're leaving the U of U. This is our third visit. Today they made a consent form basically asking the same thing for just visit now, not even for the skin graft, because we declined that. We had friends that assessed her wound, second degree burn from a pressure cooker, and they our family friends and nurses has been really helpful for helping us assessing her wound, basically going against providers at this hospital, saying that we really need this procedure done. And it's they even told us the first, probably the third day that we came here after her wound sent from the emergency room, that the one of the provider is guaranteeing that she's going to need the skin graft. It has to be done the first visit, which is like 3 days. So we declined that. She's saying, hey, I'm gonna wait. They keep pushing that. They give you all these medication. One of the medication they give you is oxycodone. Basically it's opioid, and that will, you know, mess up your ability to think, and you're not going to be able to think straight. So anyone that's on this kind of medication, make sure that you have someone taking care of you, like a caretaker or a friend or a family member, making these medical decisions when you come to these kind of clinic. Because like my friend was telling me, these medicines are making her listening to, you know, whoever is in charge. And, you know, some of these, she does not live far, we live far away, so we would have to drive back to this area to get supplies. Sometimes they would give us the wrong supply. The first time we were on Silvadene, which is a topical cream put on your wound, very thick, kind of like icing for the second degree burn. That was great for, you know, for what they did for us with bandage. They gave us enough of that. The second time we came back, they were giving us more of a hard time to give supplies. Always, again, another provider. They switched provider around, basically telling my friend that again, she needed the surgery again. And we found out that this guy is just a physician assistant, and he's under the other surgeon, whatever her name, I'm not going to mention her name, but basically they were in the same team pushing for the surgery, for the surgery for the second degree burn that my friend had. But finally, the third week we came, we met a really nice provider, was really honest about telling us and assessing my friend's wound on her leg, on the second degree burn, and basically telling us that, didn't even mention about surgery or anything. Her wound looked good. That all we needed was they changed us from Silvadene. At first, they wouldn't supply us with Silvadene. They were saying that it would slow down a wound. We were trying to get, obviously they're the only burn center here, so they kind of can control the supply. They told us that they wouldn't provide us that, just to use whatever we have if we don't listen to them. So we had to use whatever supply we have left. And finally, the third supply, the third visit, we met a really nice provider, and she told us they put us on, actually, no, I'm sorry. The second time, they changed us over from Silvadene over to Medihoney. And they were telling my friend that has the burn that, the burning would go away after 30 minutes. But with the Medihoney and Baxicitrin, which is a ointment mixed with this Medihoney, it's a yellow substance, it was burning her legs for like hours. And this is the wrong kind of procedure, that they cut us off Silvadene to put us over to this Baxicitrin and Medihoney with a mesh netting. And my friend here, who part of her leg didn't have any skin, only the perimeter of her wound, which is huge wound, only part of that had skin. The rest of the wound was just open, exposed, and they put us on this medication that would burn for hours. And not only that, the netting that they put us on, they changed from the gauze, which is, working fine with the other type of wound dressing, change it over to this netting. And when they put this on, I knew it was going to be a bad idea, because I knew because of the how early on it was for the wound, and her discharge. This yellow substance was still coming out, oozing out of the wound. And because of that, and because of the netting, and because of the Medihoney was so thin that they put on, it was dried on the netting for the wound care. And it would take me and my friend about 4 hours of pain and agony to rip this stuff off of her skin that was dried, to do the wound dressing at home that they sent us home with this stuff. So we called back, and they wouldn't resupply us with Silvadene, which is just a topical cream, very soothing for, at least 2-3 weeks of the wound. And the provider would I would call, and I asked them, listen, Medihoney's not working for us. The netting, the new style of wound dressing was not working for us. We wanted to switch back to the Silvadene, which is working for the first 2 weeks until at least her skin grow a little bit, so that she has some skin, so that we can put this netting on. Otherwise, it would the drainage that was coming out of the wound would stick to this netting, and it would be so much painful to rip this off, even with Oxycontin medicine, and we were taking all these nerve medicine that they gave us, was not working. So finally, we did not listen to them, of course. We went to another provider to get some Silvadene, just to hold us. So we came back on the third week. Sorry if my timeline's a little off, but it's very frustrating to deal with these clinics that think that they can control the supply of medicine and wound care and all that stuff, that technically they're billing the insurance anyways to give this to you, but they really want to make it hard and difficult for you to do these kind of wound care at home, so that you would basically, with the pain and agony of ripping this stuff off, to go for the surgery, which some people would not need. But again, any kind of wound, especially burn wound, it's gonna take some time for the wound to grow the skin back. So if you're sitting there and you're worrying about your wound, I'm telling you that from my experience, I'm no doctor. I'm just helping my friend. I know a little bit about medical, and I've been doing a lot of research to help my friend, because she knows nothing about this stuff, and only listening to the doctors and these providers, which is not helping us at all at this point. Finally, we came to the clinic again, because they keep switching provider around, so you don't have to call and switch provider, because we were thinking about that, because the other two provider in the beginning of the visit were not really helping us anyways. So the third visit, we did find a good provider, and she did tell us honestly, with her experience and everything, that my friend her wound would be fine as long as we keep it moist. We do change the bandage once a day. I do recommend people cleaning the wound. At first, it's gonna hurt a lot if there's some drainage, especially with drainage dried on the wound. It's gonna hurt a lot, but my recommendation is you have to take all that yellow drainage off before you put any kind of topical ointment on, and before you seal the wound with gauze and some kind of compression. I'm sorry, I'm not really good with these technical terms, but it's like a pink wrap that you have to put around your leg to keep everything together. That really helps, and it also, from my experience, really helps if you take that stuff off at night. You don't need that stuff when you're not walking. You do not need that wound compression. But I do gotta warn you that if you don't take ibuprofen, and if you don't keep that wound compression, and if you keep your feet down and not elevated at night, or even just after walking and standing, that your feet is gonna get swollen, and that could be a bad thing. And you can run into a medical condition called PT, where it's so swollen that you're not gonna be able to walk. So definitely steer away from that. Here are some other advice that I can give you by doing wound dressing for my friend for the last 3 weeks. Is they move the new provider move us over to this non-stick foam. I'm sorry, I don't know the real technical term. It's a one size sticky foam, and that's the side that you peel off of some kind of plastic covering to keep it away from dirt and all that stuff. Basically, you peel that off and you stick it on the wound. But before that you do that, the third visit, the lady switched us over, instead of the Medihoney and stuff, which is burned, and that didn't work for my patient. Not saying that it's not working for you, for your own wound care, but we switched over to back situation, which is a regular antibiotic ointment, and it was so thin that we cannot just put gauze over it, because if you put gauze over it, within an hour it's gonna suck all that ointment, and you're left with the wound, especially where there's no skin. It's gonna be open wound, and that's when it's gonna really hurt. When you're trying to walk, when you're trying to move, any kind of movement, that gauze is gonna cut into the bare tissue with no skin, and you're gonna be in pain. You're not gonna be able to walk. So by switching over to the back situation, they also added vitamin A and D ointment, which is I think it's for baby diaper rash, whatever, that you can buy at CVS. We did mix that in with the back situation ointment, which is an antibiotic, and that really made the topical application on the wound a little more thicker, and it really helps your wound with the especially with the foam. I'm sorry, I don't know, bandages. That's what and I had to cut different angles because they come in a little big sheet. For I don't know where you're wounded, but my friend, both of her leg, her shin, her ankle was affected, so I had to cut little slit for this bandage to go on. After that, area where there are no skin, you're gonna have to lift up the bandage and apply more of this ointment, so that it's a thick layer. You know, it's every I want to say every quarter. If you and like depend if you're upright, if you're sitting, if your wound is open, and it also help big time if you're putting this ointment on and it's burning, to let it air out. They did not give us any kind of tips or anything at the hospital. They have no clue, honestly. I'm not sure if they don't know or they didn't tell us, but leaving before you apply you tie it, before you wrap the wound up, I would advise to leave the wound with the back situation and vitamin A and D. After 3 weeks, wrap it up, leave it, not wrap it up, I'm sorry, leave it on top and air it out for about 10-15 minutes. Basically, just leave it, leave the, I would use look like a popsicle stick, or the tongue compressor, they call it. I usually put a layer on, like icing on a cake. I leave it there for about at least 15-20 minutes before you close up the wound with the foam. I'm sorry if I don't know the technical term. With the foam, some kind of, it's like a padding, I want to say, but it's also like a bandage. and then you put the regular gauze on top of that, and then the compressed gauze if you're gonna be doing any kind of walking, because it holds everything together. Section where especially where her ankle is on the side, the foam was still rubbing against her ankle, and she was always in pain, cannot walk. What I did was I cut a hole out on the regular padding so that the regular padding is not just touching it. I would put even a bigger slab of the Bacitracin and vitamin A and D mix, and I would put another piece of gauze, like a separate cut, another piece on top, and then I would close up the wound with gauze and the compressor, and that really helped because it recreates isolation layer of just cream. Just like if you were in the beginning using just Silvadene, it would leave a thick layer of cream where it's not the gauze or the foam padding was not touching the wound, which is bare tissue, and that really helps the patient to walk. And I hope this helps a lot of people who are doing wound care with burn at home, because even at this clinic, which is the best in the country, they were not doing everything that they can to help patient, basically just getting you in and out for wound care. They were just washing your wound off with a towel, baby soap, warm water, basically scrubbing that stuff off. My friend was so in pain that she's like, no, you're not, you guys are not doing your, they send in, some of these they send in their student trainers who has no clue how to do burn care, and they would argue against someone like me who does it every day for her, and they told us that's the process, that's our technique. And I'm like, well, that's your guideline, your technique for your own clinic, but this is, you can't push that same guideline and techniques on every single patient, because everyone's gonna be different. Every wound is gonna be different. You can't use the same guideline and techniques on every single patient. And another thing with this place is they would scare you into doing the skin graft, which is kind of scary, because they're the one that's really, you're gonna listen to them. They're the care provider, and they're pushing you to do this stuff, in my opinion, because half the time they're getting money off insurance or you, because you're sending that consent paper saying that, if the insurance doesn't cover, that you're gonna have to pay out of pocket. And like I said in the beginning, that some of these medical procedure costing $10,000 to $30,000 out of pocket for the procedure, not mentioning overnight stay for about 2 weeks to regrow your skin, where the area where they're cutting your skin to do the skin graft. They don't tell you this stuff up front, and half the time the patient have to figure this out, sometime possibly too late, to pay all this stuff out of pocket. And thank God that I'm not sure, I just went to do all this research online to try to help my friend. So make sure that when you go to these burn center and clinics, and not just this one, that you do some of your own research, because some of these care provider, to be honest, I thought at first, if you go to the hospital, you're hurt, that you're supposed to be taken care of, even with insurance. Today we went, this is the third time visiting this clinic. They made us sign, basically telling us that if we don't sign this consent paperwork, that they won't see us, they won't admit us for our visit to change her wound, which is kind of ridiculous. If people are in need, that's why they come to these places, and they're not admitting it, because basically they want to make sure that you're gonna pay for everything that they bill at one point, or even they're taking money from they can bill the insurance saying, okay, the insurance are only going to cover this part, and then they can write extra code or whatever into your visit, and may you pay for extra for the other part. And I think that this is the part of the medical billing that a lot of people should definitely pay attention to, that so that some of these places are not screwing you with your money, because I think that a lot of people are blindly with medical billing. They don't have no clue. They only listen to these clinics and medical facility where I think it's wrongly helping the public. And I hope that this video kind of opens some light. And if you want, this is not usually what I do for YouTube, but hopefully this kind of help a lot of people out there who are looking for answer when it come to medical billing and wound care for second degree burn. And when it comes to U, which is University of Utah, this is our horrible experience that we've been giving wrong medicine, the not trained profession coming in doing these kind of wound care where, you know, if they mess up, you know, bacteria or anything get in, that could cause a wound infection, and that would be a major disaster. So, you know, some of these places are putting medical students which have no training. For some of these people coming in doing wound care, for my friend here, I can guarantee that they have no idea. I'm sitting there telling them what to do, and I'm not even a doctor, I'm no nurse, but I've been doing this every day for my friend for the last 3 weeks. So believe me, I have some experience with, you know, especially her case on wound care. So I'm hoping that this kind of video would help people shed some light on this kind of, you know, clinic where they're claiming to be. It is. I mean, at first, you know, if you walk into the place, you know, the greeter, the people doing the valet parking, the receptionist, everybody's nice to you. You know, you feel like you're walking at home the first few visits, but as soon as we decline the skin graft, where they're going to be making most of the money from surgery from us or from our insurance, that they change their tone right away to the point where we're leaving. We didn't even see them today. We're going to go to somewhere else. And even though they're the best one, I mean, her wound is pretty healed. We only really need coming today for supplies. And they're basically cutting us off supply before. And today they refuse to see us because they want to make sure that we sign that piece of paper so that they can, first of all, bill insurance and also bill us whatever they want if you sign that piece of paper. And I think that is very, you know, a very wrong way of dealing with people who are in need, especially for medical attention in this day and age, 2020. Thank you. And if you have any question, or just leave it in the comment. I'm sure a lot of people can help. I'm sorry if my procedure or anything that's a little off, but that's what really helped my friend. For the last 3 weeks, I've been helping her with the wound care. She has no family here in Utah. I flew all the way from California to come here to help her. You know, I'm hoping that this video will shed some light and help a lot of people out there, answer a lot of questions out there with wound care and medical billing. Thank you.